8:48. And on our line right now, Dr. Joseph Burkhardt of Bronson Orthopedic Specialists with offices in Battle Creek and Marshall. Dr. Burkhardt, good morning. Nice to have you with us.
Good morning. Thanks for having me.
Lately when we've been talking about COVID-19 and Dr. Fauci and the like, I've made these statements that medical science ain't rocket science. But I gotta say, when it comes to your line of medical science, you guys are the rocket scientists. I'll tell you what, some of the stuff you guys do, I just can't believe.
I appreciate that. We try and do our best.
Well, I wish we could catch up in the disease department and in the study of the brain department and a few other areas, but some of that stuff is just hard to figure out, and it's a moving target. But boy, the advances in medical science when it comes to relieving hip and knee pain. Let's talk a little bit about what joint pain is. What is causing that?
Well, there are three main categories: traumatic or post-traumatic, degenerative, which is just normal wear and tear, and then inflammatory, like rheumatoid or gout or lupus, some of the autoimmune diseases.
And so tell us a little bit about treatments. I mean, we know about joint replacement, obviously, but there are plenty of things that you guys do leading up to that, before you get to that.
Right. We really try and focus on exhausting and non-operative treatments before we proceed with any surgical recommendations. And those include things like injections of corticosteroids or different types of lubricants that are available, non-steroidal anti-inflammatory drugs like Motrin or Naprosyn. There's a whole variety of different types that are available. Topical creams can be used too. There's a non-steroidal anti-inflammatory creams that are more available now, newer kind of concoctions that you could rub on your skin, physical therapy, and then, of course, the one that nobody likes to spend time talking about, and that's weight loss. Everybody sort of focuses on that, but that can help too.
Sure, try carrying a cement block around with you for a week and see how your joints feel, and then try it without it.
Right.
So
yeah, that's a great analogy. I tell people, think about carrying a 40-pound bag of rock salt around and being able to let that go. What a difference that would make.
Yeah. And as the older you get, the more that 40-pound bag of rock salt seems to weigh. So,
For sure.
Gravity is a terrible thing. And, so let's say we've tried all these non-surgical options. What's the next step then in treating joint pain?
Well, when you're dealing with the hip, knee, and shoulder, replacement options, whether it be a partial or a total type replacement, is sort of the opening discussion, and then the methodology behind how we put those things in place. With robotic-assisted equipment now, we can really improve the replication of both the anatomy and the tension that we put the implant in relative to the ligaments within the joint. And all that translates to is just better overall function. So the initial goal was to lessen the pain, but now the expectation is to lessen the pain and improve function, so people can not only feel like they're at less pain at rest, but when they're active, they feel like the implant is under them and stable and allows them to do the activities they really like to do.
Sure. And we were talking to retired police officer Dwayne Knight a few months ago. He's a triathlete. I mean, he's not just a guy doing day-to-day moving. I mean, this guy does stuff that I almost keel over thinking about it. And he had some joint replacement surgery. It was just amazing that he could still go out and compete at that level. So that
he had a hip resurfacing as an alternative to total hip replacement.
Right.
Hip resurfacing is a different sort of implant that relies on the natural oil that's produced in your joint to create a lubricative layer between the surfaces of the implant. And so it almost works like a car piston where you're dealing with a high carbide bearing that is lubricated by the oil produced by your body.
See, it is rocket science.
It's pretty cool stuff, and he's done some amazing things with his implant.
Yes, indeed. Now, I got to ask you, since the pandemic started, first of all, a lot of replacement surgeries and the like were postponed, and finally you guys got back into business. So what precautions are being made for our patients who visit you?
Well, we've always taken a lot of precautions to keep patients safe, but when the pandemic hit, it heightened everything. And whether that's in our practice or joint replacement classes or at the hospital. So the main things that changed are anyone that enters Bronson property, whether it's a practice or outpatient facility or the hospital, they have to be screened and wear a mask. Everybody that enters our practice has to practice social distancing. All the chairs in the exam room, and furniture and doors and handles and everything are wiped down after each patient. We have joint replacement classes, and we've limited the number of people in each class now to 10 people, and that includes 2 instructors and 4 patients and 4 coaches. And everyone in the class needs to wear a mask and follow the social distancing recommendation. And if you're scheduled for a surgery, before the surgery, we do a preoperative COVID testing 48 to 72 hours prior to the surgery, and the patient needs to self-quarantine for a week before their surgery. And then when they're in the hospital, we limit them to 2 visitors while in the hospital, and it has to be the same 2 people for the entire stay. So those are the changes that we've implemented.
Dr. Burkhardt, if we'd like to make an appointment, what can we do?
Our number to call our office is 877-704-3133. We also offer same-day appointments if you call in, so you can get right in.
Right. That's great. 877-704-3133. And I imagine the website as well is a good resource.
Yep. The website is bronsonhealth.com/ortho.
All right. Dr. Joseph Burkhardt, thanks so much for joining us today. You keep up the great work.
Okay. Thank you. Thanks for having me.